The healthcare industry depends heavily on accurate medical coding. Coders translate diagnoses, treatments, and medical procedures into standardized codes used for billing, insurance claims, and record-keeping. Without precise coding, healthcare organizations face delays in reimbursements, compliance issues, and even legal risks. That's why employers place great emphasis on selecting the right candidates for medical coding positions, individuals who not only have technical knowledge of ICD, CAPTAIN, and HCPCS systems but also demonstrate attention to detail, ethical judgment, and problem-solving skills. When preparing for a medical coding interview, candidates should expect a mix of technical and behavioral questions. Hiring managers want to see how well you know the coding systems, how you handle difficult cases, and how you work under pressure. They also want to assess your communication skills, since coders often interact with healthcare providers, insurance representatives, and administrative staff. In this video, we will explore the most common medical coding interview questions, provide sample answers, and share helpful tips to help you approach your interview with confidence and clarity. Question 1. Can you tell us about your background in medical coding? Answer. My background in medical coding began with a certification program where I gained knowledge in ICD-10-CM, CAPTAIN, and HCPCS coding. After certification, I worked at a large hospital where I handled inpatient and outpatient coding. I collaborated closely with physicians to clarify documentation and ensured compliance with federal and insurance regulations. Over the years, I've developed strong attention to detail, accuracy in coding, and a deep understanding of healthcare billing procedures. Tip: provide an overview of your certifications, work experience, and highlight both technical and interpersonal strengths. Question 2. What coding systems are you most familiar with? Answer. I am most familiar with ICD-10-CM for diagnoses, CAPTAIN for procedures, and HCPCS Level 2 codes for supplies and services. I've also used ICD-9 in the past, but I primarily work with ICD-10 now. In my previous role, I regularly coded surgical procedures, outpatient visits, and durable medical equipment. My familiarity with these systems allows me to accurately assign codes and minimize claim denials. Tip: always mention the standard coding systems, ICD, CAPTAIN, and HCPCS, and connect them to your hands-on experience. Question 3. How do you ensure accuracy in your coding work? Answer. I ensure accuracy by carefully reviewing the medical record, including physician notes, lab reports, and discharge summaries. I cross-check with official coding guidelines and verify that codes reflect both medical necessity and compliance requirements. Additionally, I use auditing tools and stay updated with annual code changes. If I encounter unclear documentation, I reach out to providers for clarification. These steps help me maintain precision and reduce errors. Tip: show that you follow a structured process, stay current with updates, and value clear communication with providers. Question 4. How do you handle discrepancies or incomplete documentation? Answer. When I encounter incomplete documentation, I first check if the missing information can be verified from other parts of the medical record. If not, I follow the organization's protocol for querying the physician. I always ensure my queries are specific, respectful, and compliant with guidelines. For example, instead of suggesting a diagnosis, I frame the query neutrally, asking for clarification. This approach maintains accuracy without influencing provider judgment. Tip: stress professionalism, compliance, and the importance of ethical queries. Question 5. How do you stay updated with changes in medical coding guidelines? Answer. I subscribe to updates from the American Health Information Management Association, AHIMA, and the American Academy of Professional Coders, AAPC. I also participate in webinars and training sessions, particularly during annual code set updates. At my previous job, I was responsible for sharing new coding changes with my team through internal workshops. Staying current is essential because outdated knowledge can result in costly errors. Tip: demonstrate commitment to continuous learning and awareness of industry resources. Question 6. Can you give an example of a challenging coding case you handled? Answer. One challenging case I worked on involved a patient with multiple comorbidities and several overlapping procedures. The physician's notes were complex and required careful interpretation. I reviewed the documentation thoroughly and identified that some of the codes initially assigned did not fully reflect the treatment provided. After clarifying with the physician, I corrected the codes, which ensured accurate reimbursement and avoided compliance issues. This experience reinforced the value of attention to detail and clear communication. Tip: use a specific story to demonstrate problem-solving, persistence, and the positive outcome of your actions. Question 7. How do you manage productivity while maintaining accuracy? Answer: I balance productivity and accuracy by following an organized workflow. I set priorities based on claim deadlines and ensure I allocate time for reviewing complex cases without rushing. I also use coding software to flag potential errors, which helps save time while maintaining quality. In my previous role, I consistently met productivity benchmarks while maintaining an accuracy rate above 98%. Tip: highlight your ability to meet performance metrics while ensuring compliance and quality. Question 8. What do you do if a claim is denied due to coding errors? Answer: when a claim is denied, I start by reviewing the denial reason and checking the original documentation. If the denial is due to an error in coding, I correct the mistake and resubmit the claim. I also track recurring issues to identify patterns, which helps prevent similar denials in the future. Additionally, I collaborate with billing staff to ensure the correction aligns with insurance requirements. Tip: show that you focus on both fixing the immediate issue and improving long-term processes. Question 9. How do you handle confidential patient information? Answer: I strictly follow HCPCS regulations and organizational policies regarding patient confidentiality. I ensure that all coding work is done on secure systems and never share patient data outside authorized channels. Even when discussing cases with colleagues, I avoid unnecessary details and maintain professionalism. Protecting patient privacy is a core responsibility in medical coding, and I take it very seriously. Tip: employers want assurance that you respect confidentiality and adhere to legal requirements. Question 10. Why should we hire you as a medical coder? Answer: you should consider hiring me because I bring both technical expertise and a strong commitment to accuracy and compliance. My coding certifications, hands-on experience with multiple coding systems, and history of minimizing claim denials demonstrate my technical strengths. Beyond that, I am reliable, detail-oriented, and proactive in staying updated with industry changes. I am confident that I can contribute to improving coding accuracy, reducing errors, and supporting efficient reimbursement for your organization. Tip: position yourself as both technically capable and personally dependable. Tips for medical coding interviews. To succeed in a medical coding interview, focus on 3 key areas: technical knowledge, accuracy, and compliance. Review ICD-10, CAPTAIN, and HCPCS systems thoroughly and prepare examples of how you've applied them in real-work settings. Be ready to explain how you handle incomplete documentation, claim denials, and productivity pressures. Employers value coders who can balance speed with precision, so emphasize your workflow strategies. Lastly, highlight your commitment to protecting patient privacy and staying current with industry updates. Conclusion: medical coding interviews are designed to evaluate both your technical knowledge and your ability to apply it responsibly in real-world healthcare environments. Employers want coders who can manage the complexity of healthcare documentation, ensure compliance with regulations, and minimize costly errors. By preparing thoroughly, sharing concrete examples, and demonstrating attention to detail, you can stand out as a strong candidate. A successful medical coder is not only accurate but also adaptable, ethical, and committed to continuous learning. If you prepare with these qualities in mind, you will be well on your way to excelling in your next medical coding interview.